Hey, everybody. Welcome to another episode of The Exercise Mechanic. Today, we are joined by Yannick Schulz. Yannick, how's it going today, man? Thanks for being here.
Very good. Thank you guys for having me.
It's a pleasure. It's a pleasure. Leading up to the episode, we have a tendency to kind of dig into people's past.
Okay.
No, I'm just playing. Not necessarily the past, but specifically the past that finds itself on Instagram. And through doing that, I noticed that you posted something interesting today that I think would be a really good place to start, which is that there are no necessarily inherently good or bad exercises, which really kind of flies in the face of a lot of advice that we get in the fitness world. There's a lot of exercises that, you'll see someone do a demonstration and big red X or green check mark. This is good technique. This is bad technique, good exercise, bad exercise. And I'd like for you to perhaps tease out why you said what you said in terms of how there are no inherently good or bad exercises.
Yeah, I'd love to dive into it. I'm sure that's a rabbit hole, but it's like you said, right? Things get demonized in the industry of, again, what's technically good, what's technically bad. And I think especially with Instagram nowadays or with any of these social media platforms, you're seeing such a small piece of information. And it might be helpful with the red X and green light on a certain exercise, because there are things that tend to be a little bit more, I hate using the word dangerous, but maybe either less effective or not as easy for people to get into those positions. But all that to say, I don't think there technically is anything that is truly bad for anyone, right? A lot of it just comes down to the execution, the form, and the ability to tolerate that load. So there is, in my eyes, like a functional capacity at which somebody can break. And that makes the exercise bad, but that's not that the exercise was bad for them. It's just that they weren't ready for that load. So again, the context is what makes it bad. And the video that I posted talked about kind of three main exercises that I heard, and I'm sure you guys have heard for years. You had the upright row, dips, and I forget which other one I talked about, like a behind the neck press or something like that. And especially like dips. I remember I had shoulder injuries since high school. And I just remember for the longest time by physios, everyone told like, don't do it. It's like the worst thing to do, especially an upright row. Mm-hmm. And again, it really comes down to the context and your ability to maintain the position and stabilize. So I think that applies across the board to any exercise, really.
And yeah, I love that. And, one of the things that for me just feels really true is like, if you take any exercise beyond an individual's capacity, whether it be like the capacity of whether we call it like the nervous system or the capacity of like the sensitivity of the organism, or if we're talking about just like you take it beyond tissue capacity, things break. It doesn't matter if we're talking about elbows, spines, knees, ankles. It doesn't matter. You take anything beyond that point and bad shit happens, right? And that's why I think like generally speaking, just having load management conversations with folks and talking about relative capacity, not only from an individual perspective, but also from a joint specific perspective, I think those are the relevant conversations to have, in contrast to inherently good or inherently bad. Like you're kind of touching on, it's a little bit more nuanced than perhaps the red X on Instagram leads us to believe.
Yeah, 100%. Yeah, I think you got to take all that with a grain of salt. And yeah, I mean, one of my favorite lines, and I forget who originated it, but it's Craig Liebenson. If you guys know that name, he's the one who kind of brought it to light. And he talks about it's not the load that breaks you down, it's the load you're not prepared for. Again, that applies to anything that could be as simple as like walking off a curb and you roll your ankle. Well, again, was it really that? Was it that? Yes, that's maybe a little more traumatic situation, but could it have again been that you were not stable and not ready to accept what that demand was? And that applies again to any weightlifting exercise as well, or rehab or whatever it might be.
Yeah. And, sorry, Ryan, I think I just cut you off here, but like, you mentioned like the load that you're not prepared for. What's your take on doing exercises in like funky positions as a means of exposing the body to stressors? So example, like loading an ankle when it's inverted, and like stressing the lateral ankle specifically with the hope of preparing it to tolerate stressors, or going into like, all gas, no brakes, knee valgus as a means of like fostering strength and desensitizing joints in those positions. Is that something that you use clinically, or perhaps because I know you're also a trainer, which is like an interesting angle that I find you bring to this conversation.
Mm-hmm. Yeah, so I mean, I always look at it from both lens, the like rehab chiro lens and then the training lens as well. But I think for me, it's always re-exposure, right? So as you're saying, like, do I want to go to the furthest extreme on that exercise right away with like an ankle inverted position? Probably not. But do I want to work my way into that position because there's a chance that I'm going to get there? Again, I think it's sport and, you know, condition specific, right? If you are somebody who's going to be in those positions, whether it's gymnasts, whether it's even a soccer player who they tend to roll their ankles quite a bit, you might want to re-expose yourself to those positions more frequently and strengthen those positions potentially more than just like the average weightlifter who's not going into inversion that much outside of like a day-to-day experience. But I think it's all a graded exposure. You start at a certain level and you upgrade that. And I think any exercise, I've always thought this is like any exercise that you want to get to, or whatever the outcome is you want to get to, you should always have a regression and a progression that you can kind of work through. Like, what's my 4 steps up and what's my 4 steps down from where my point is, and how do I get to those points? And again, that kind of plays into that exposure. I don't know. That's my way of looking at it.
I think sort of taking this conversation in a similar direction, but we actually spoke about this yesterday briefly, and I
Sport
think you and I
specific?
are probably more. No, but
No?
we will talk about that too. But Yannick and I actually spoke about this a little bit at the gym yesterday with Paul, and I think you and I might be more aligned on this. But I'm curious what your thoughts are on, to what degree is there an importance of like hyper modifying an exercise to fit an individual versus, you know, the quote unquote, like just stick to the basics, whatever it happens to be. To what like degree do you think the role of making an exercise really fit an individual actually plays in terms of their ability to progress?
Yeah. So, I mean, again, I think it's always going to be kind of context specific. I think people go hyper focused too fast a lot of times in the training world, meaning they're going to. So I think of things, I'll look at it as like we've got, you know, your uni-regional, bi-regional, and then multi-regional type of movements, right? Uni-regional being something more isolated, like a hip internal rotation, and finding a way to isolate that movement. Problem is, in a lot of like training or rehab context, you're going to see people go straight to the multi-regional thing when you haven't even necessarily resolved the uni-regional movement. So in that sense, it's like that you can kind of look at it both ways. Are you hyper fixating on one thing, or are you hyper like going over the top and trying to do too many things, right? So if the body can't even rotate in a certain position, but you're now asking the entire body to like a whole body demand, are you really getting what you want out of that? Or are you just kind of making that person think that they're getting there? I don't know if that exactly answers your question, but in a sense, I think that that's in the training sense as we go, almost we want the fancy thing right away, right? Because it wows our client. Or in the I'm thinking of it more in the rehab context. It's like people want to wow their client right away with like, here's this fun fancy exercise, where sometimes the most
Yeah.
like basic little thing is going to be what they need to start with and will get them a better result in the end, even though that seems less like sexy to them. So to me, it's like that's where that hyper like fixation in a sense is, you're going too big too fast instead of kind of narrowing in a little bit more. I don't know if that answers, but
I think it brings up a really interesting point though. So especially in like a rehabilitative setting, how are you determining whether or not it's appropriate to say maybe start with the more isolated joint movement or position versus having a more integrated exercise?
I think it always has to be assessment, right? It's the old, if you're not assessing, you're guessing, and it's exactly that. Because if I don't know, if I don't take you through a movement pattern, if I don't test something, I have no idea what your capability is, what your competency level is, or what your capacity of that tissue is. So then once I know the area I'm looking at, then I can go as a clinician, I can go passively and test the structures. I can go see. So it's going to tell me, like, if you have an internal rotation blockage and you can't even rotate, you know, like 10 degrees, you're likely not going to be able to tolerate a hip airplane where you're asking you're going to get it from the lumbar spine. You're going to get it more from other areas rather than actually getting it at that area. But again, I think that has to be purely assessment. Now, you could say that, there's the context where somebody has poor hip internal rotation, but they can still get into a pretty good squat. So it's like there's levels to that. But I think at the end of the day, I would still say something is going to break somewhere at some point. And to get in, like, the body is a master compensator. It will figure out how to get something done, whether it's the right way or the right thing. And eventually something is going to get overloaded. So I think that's why, as a clinician, it's important to do your assessment, which will then deem, okay, you are ready for this, or no, we just got to go back down a couple levels. And again, that's movement pattern, that's testing you. I mean, every position can be a test on its own, just even putting you into a squat and then seeing how you move. So
no doubt. You mentioned earlier about the necessity, and this might be my language, so forgive me if this isn't how you would necessarily explain it. But when it comes to like working on some of these components or like uni-regional work, if you're finding that there's a deficit in a very specific region that is in many ways kind of like a requirement for a more global exercise. And you also kind of touched on this tendency of people wanting to do the sexy things. How do you sell the necessity of doing the foundational work, whether it be to your clients or the people that you work with clinically? Because I'm assuming that, you've probably noticed in the same way that I have. And if you disagree, let me know. This is a safe place for it. But like, buy-in is huge. And
I was just going to say that. So
yeah. So like, how do you do that when it comes to getting people fundamentally bought into something that they maybe don't want to do, but you view it as being a prerequisite for their progression? How do you work through that?
Yeah, I mean, that's where my head was going, was the buy-in. Like, you have to have buy-in for the person to want to do that, because otherwise they're not going to do the little things. We already know it's difficult in the rehab perspective, or even in the gym perspective, like, to do these little things when, again, that doesn't seem like the fun thing that's going to lead you to the result that you want. So I think it's like, you have to make that link of X is going to help you be able to do this. So if they don't have an understanding as to, like, if you're just doing it to do it and you're not explaining to them or educating the client or patient as to why this is going to help, of course they're not going to want to do it, because there's no understanding of it. And they don't have to know every anatomy in detail, but it's just a broad understanding of, see this, and we are doing this to help further this. And usually if you can get back to like a movement or something they want to do, right? Because ultimately the person just wants to be able to do what they want to do. Even if it's simple as like lifting your shoulder to get a cup of coffee out of, the cupboard. That's the thing you want to be able to do. But maybe you can't lift there quite yet and your pattern is off. But doing this exercise will help you get back to this point. So I think it's always like leading it back to what they want to do. And of course, as a clinician, if I can create change immediately, so I always like going back to this, because everyone has crappy internal rotation for the most part in their hip if they have poor internal rotation, and I can demonstrate that to them, because usually it's pretty obvious, and a lot of times it is a little more one-sided than another. So if I can go in and demonstrate, like, look how this is not moving how it should, and they can usually feel some sort of kind of like end range restriction or a bit of kind of blockiness, and then if I can create rapid change with that, and a lot of times if you're using the proper, like, I would call them kind of more neuromuscular techniques, where we are basically overriding the brain to allow us to get more space, assuming it's not a structural issue, of course. Usually then you can create more space very rapidly, and they're going to see that. And then it's like, wow. And then they're willing to do the work to get there. And then that might even translate immediately into whatever the exercise or movement that they wanted to do. So again, I think it is creating that buy-in and being able to show the tie-in for them, because otherwise, if they don't see the reasoning behind it, they're not going to do it.
No doubt. And you mentioned like internal rotation. It's like a really common thing that you see a lot of people lacking. Actually, there's a term that the kids are using nowadays. I'm not actually making this up. One of my friends is that he works in schools as an educator, kind of like personal development for kids. It's actually kind of interesting. It's called Camp Lift, and it's in Quebec. It's kind of interesting. Anyways, the kids teach him lingo. And one of the things that the kids taught him is that there's an expression, which is caught you lacking. So like if you catch someone just like,
I was wondering where that was going,
like their hair doesn't look good, or maybe their posture shit, you could be like, yo, Yan, caught you lacking,
It's sad that I know exactly what they're trying to say.
Right. So let's say you're with a client, you catch them lacking internal rotation at the hip,
I'm
and
using
you're
it
noticing
now.
this over and over and over again. Like, why do you think that is? Because my guess is that if it's really prevalent, there might be like maybe a common denominator. I'd be curious to know if you have any hypotheses about why so many people are caught lacking hip internal rotation.
I think we see internal rotation a little bit more, especially in the hip. I think it is, again, it's compensation, it's pattern, it's the way that we tend to bias things. You would kind of think it would be a little bit more external rotation for the most part, but I feel like life leads us a little bit more that way. Whether it's postural, whether it's sitting position, whether it's the repetition in sports, you'll see it a lot more. Like the area you see it the most is hockey players. Me being an example, like I grew up playing hockey my entire life. My internal rotation is quite garbage. Even though I do work on it, it is still not the greatest. And I see it repeatedly with anyone who plays. I can almost tell if the person's played hockey just by like assessing their hip. Now I see people with poor internal rotation who didn't play hockey, but again, it's usually the bias of what we're doing. And that could, again, be a cheat of, you don't have this, so you start to chew into another thing. But a lot of times it's a little easier to bias, your external rotation or move into that position. So we stop using that over time. And it's kind of the, what is it? Don't
You
use
don't
it.
use it, you
What
lose
is
it.
it? Yeah, whatever the 40-year-old virgin quote is.
Is that in that movie? Don't use it, or if you don't use it, you lose it. Really?
He asked the question. Yeah, I forget how it goes. He's at like a sit-in meeting, and he's like, "Is it true if you don't use it that you lose it?"
Okay, I do remember that. That is
I think
funny.
the bags of sand happens in that same scene, I think.
Bags of sand
Yeah,
is pretty
it's
clutch.
similar.
Yeah.
But I do think that, yeah, I mean, it's hard to say exactly for me. Like I can't pull up a piece of literature right now to say this is X reason why, but I do think it is a lot of like, it's habitual, the, the compensation in the patterns, and the fact that we go away from this and also tend to not really put ourselves into those positions to continue to work that. Again, like you might see it a little bit more in somebody who does use rotation, but then again, usually sports are going to be a little more unilateral. Tennis, you're going to rotate one way more than the other. So you might be really good internal rotation on the side that you're basically doing your backswing, or you're on the other, but a lot of times it's more one-sided. It's a racket sport. Same with golf. You're rotating more one way. Yes, you need internal rotation both ways, but you're usually going to dominate one side and chew into that side a little bit more. So again, I think it's just habit.
Yeah.
I think for the sake of maybe seeing how this could apply for, like, a lot of people that listen to this are coaches and trainers themselves, pulling on this thread of like hip internal rotation. So let's say specifically you have a lifter, they have some kind of, hip internal rotation deficit. By improving that, what realistic outcomes would they expect to see?
Yeah. So again, I mean, it depends on what they're trying to get back to and what they're trying to do. So even let's talk a lifter, right? In your squat, most of the time, if you have super poor internal rotation, you are going to shift to the opposite side. Your body's smart. It wants to find more space. If you don't have it, it's going to go where there is more. So when you see people with that bottom of the squat kind of hip shift over, that's because most of the time, not always, but most of the time, they don't have great internal rotation as we get lower. And we know that as we add hip flexion, that's when hip internal rotation becomes a little bit more difficult. So in that context, if you don't have it, you're going to shift to the other side. So technically, if you fix your hip internal rotation, we'll say left hip, you're likely not going to get that shift. And we know that the shift could cause, issues in the lumbar spine. It could cause issues over on the other side. You could push into that knee or ankle. So it could be a gambit of different things. So for that, specific context, you would see improvement in your form, your squat, and then your lift could go up. So I think it could be tenfold by just addressing that one thing. Again, if you've had this for years, does your body know how to work around it and probably compensate? Yes. So this is where you kind of beg the question of, depending on the athlete you have, when do you bother to make that correction? So
that was one of my other questions. Yeah.
Yeah. So if you're mid-season with a golfer Am I going to correct that pattern? Probably not, especially if it's a more professional level. If it's a kid who's just working through it, maybe. But if we're somewhat, semi-pro professional and this is super important to them, I'm probably not going to correct that because it is going to change their swing. So it would probably be more of an off-season thing where we can work on repatterning and all of that. But I know that a drastic change in your hip is going to create a drastic change in your swing, and that person's going to come back at you and say, you ruined my swing. So, and they love their swing, so I'm not going to mess with that.
Mm-hmm. Yeah, it's interesting. You bring up some really great points there. One of which actually kind of parallels, or some of which actually parallel the podcast that we recorded yesterday evening. Ryan, Brett, who's another member of the team, and myself, and we talked about a variety of topics, 9 specifically, but one of them was talking about sports-specific training. And of all the topics that came up, we ended up talking about just like, what is sports specific training, and how kind of a lot of people think about it. Some people view it as being mimicry in terms of like, take exercises that approximate how the sport looks and you load them. And then others, myself definitely included, kind of view it as being more so like, well, what are the joint position requirements and perhaps the force specific requirements that are required from your sport? And let's build capacity kind of within those things. And I'm mentioning this because I very much agree with you. And I think you bring up a really good point, which is like, when it comes to athletic endeavors, like, skill is so important. Timing is so important. And even though on paper, having a hip that works better would likely be good for that human being, if we think about the context of athletic, athletic prowess is so closely tied to skill. The second you start fucking with like the components that they're using and potentially messing around with timing and those types of things, you might see, like you said, their golf swing that they love starting to get compromised, or the baseball swing or what have you. I think that that's a really good point, because just because you can, this is one of my favorite quotes from Jurassic Park. I don't know if you'll roll your eyes with this one, Rye, because I don't mention this one very often. Yeah. But Jeff Goldblum talks about at one point where he's like, you guys were so focused on whether or not you could, you didn't ask yourself whether or not you should. And here he's talking about improving the hip internal rotation of the dinosaurs, of course. But I think that that's a really valid point, where it's like, you notice something, don't be so trigger happy and just choose to like go at it right away. Ask yourself, is this actually a good thing to work on right now? Because it might have detrimental effects on performance. I really love that you highlighted that.
Well, here's a great question. What dinosaur would have the best hip internal rotation?
I'm going with the raptor. That's my guess.
I was going to say something like that.
I feel like it's got to be a triceratops. They're on all fours. They're already a little bit internally rotated. You got a raptor. They're just straight. They're straight liners.
But their feet are like this. They got like these big old honking hips. The femurs are angled out. I don't know.
They're probably already antiverted. They're already in that.
You know what? I mean, I think with your clinical background, I'll have to just take your opinion on this at face value, and then we'll circle back with some imaging of Triceratops.
We'll never know.
Yeah. I'm curious. Given the fact that you have a training background and a clinical background, like we kind of talked about earlier, that gives you a little bit of a unique stance on things. In which ways have you found, or do you think that your clinical training has been an asset as a trainer? And then also the other way around, like, do you notice any blind spots in clinicians that, thanks to your exposure with training, and from the sounds of it, also as an athlete in hockey, have kind of like been assets to you in the clinical realm?
Yeah, first, I don't know if I'd say athlete, but
Michael Jordan over here.
Let's go.
Michael Jordan of hockey. Yeah. So, I mean, I think yes is the answer, but like, so the further I get and the more I enjoy the world of like fitness and lifting, the more I see the value in utilizing that as its own tool. Right. So, probably at the start of my career in chiropractic, I would have thought more of like such a separation between the two. You need to do the floor, ground, rehab exercises so that you can then do the stuff in the gym. Some of that is true, but also who's to say that something in the gym can't also be rehab? So I worked at a gym that Ryan and I both go to. So I used to be the chiropractor at that location. So especially with that location, everyone I treated was mostly bodybuilders or people who were lifting at 613 lift. And so with those athletes, a lot of their rehab was straight up, let's go into the gym and let's put you into certain positions and let's work on things. So the deeper I get into it, the more I realize you can use your lifting as mobilities. There's nothing to say that it can't be utilized that. I mean, in a sense, it's almost like a loaded stretch for certain people, right? But it allows you to potentially get into positions or use it as like a passive mobility to bring you into external rotation. I mean, a great example is something like, again, this is going to be based on the individual, but if you're doing an overhead tricep extension with the cable, technically that's external rotation of the shoulder. I'm back here, I'm bringing myself into this position. I can angle myself forward. I can have the cable coming a little bit further back. That is dragging me into overhead external rotation. And do we think of that as an externally rotated position? Not technically. We're thinking of it for the tricep itself. But we can use both to kind of achieve two things at once, or just get somebody in that position who's having a hard time like loading into an overhead position or getting like, whatever it might be. And same could apply to many other things, not all cable specifically, but obviously cable can have that line of tension that helps us in those positions. So in that context, yes. And I think it does on the other side of things. I think Chiro 100%, like the rehab context, especially, or just in having an understanding of the anatomy or how things function, helps in the training context, from, warm up to prevention of injury to just having a better idea of like what this individual needs. Potentially it's also like, and not to say you have to be a chiropractor to do this by any means, because there's lots of, great trainers who are doing probably the exact same thing, if not better, as much better than me, I'm sure. Paul being a great example. Ryan, I'm sure, is also another great example. But anyway, point being, even video analysis of somebody's movement, right? Having an understanding of what that movement should look like, where the deficits are, being able to pick that out. That's one of my favorite things now is like, okay, let's send me a video. Let's break this down. And then there's the kind of like bodybuilding context or the mind that goes, these are the positions we need to be in. And then there's the other kind of clinician side of things that's assessing like, okay, what's breaking down where and how can we position you to improve that? And you can do that virtually without even, being hands-on with the individual, which is kind of the coolest thing about how things are shifting nowadays.
Yeah, agreed.
So specifically, your experience working with lifters in a gym setting, what do you find are sort of the common like areas of opportunity, in particular with, bodybuilders, powerlifters, strength athletes, etc.?
What do you mean by areas of opportunity specifically?
So obviously they are probably training in particular patterns repeatedly. As you had mentioned before, like hockey players, you'd often see this internal rotation issue at the hip. Do you see certain patterns arise with lifters very commonly?
100%. I mean, again, we talked a little bit about this yesterday with Paul too, and obviously like tissue, when we're looking at bodybuilders as well, like the accumulation of tissue is going to make it a little bit more challenging. We had the argument, and I was making the argument that just because you have more mass or more tissue does not mean that you cannot get into these positions. A lot of times it just, yes, it makes it more challenging, but it's also because those athletes are not necessarily putting themselves into those positions or working on those things to maintain that. Mm-hmm. And when you think of like accumulation of mass or hypertrophy, you're not always looking like, yes, we want lengthened positions and whatnot, but we're always looking for the most optimal like place that I can stabilize externally so I can put as much tension or load on that tissue. But that's not always a great thing when it comes to keeping mobile or adapting to everything. So to answer your question, I mean, I see external rotation in the shoulder quite commonly. So getting into these positions, like if I can't get back into this position to be able to do like a press overhead, a lot of times you see that into the elbow. I commonly see guys who are talking about like elbow pain when they're pressing, when they're bench pressing, all this stuff. And a lot of times it's one, it could just be overuse of the tissue or not controlling the movement. So, but if we're talking about form itself, if you can't get into an externally rotated position to do a shoulder press, you're going to dump internally, which a lot of times is then going to shift energy somewhere. So if it's not in the shoulder, it's going to go generally down into the elbow, right? So then you overload the tissues at the level of the elbow or the wrist or whatever it might be. So yeah, you're going to commonly see that. Obviously, then we can go into wrist and ankles and more of the extremities, because if you have a deficit there, kind of the same principle applies. It's going to go kind of up the chain. If you have poor wrist mobility, can't get into that extended position, that's going to find its way kind of down. So to me, it's like energy always has to go somewhere. Energy in the context of like the load, the force, the transfer, it has to go somewhere, and it's generally going to find its way into the joint or the structures, and that's where we end up getting into injury rather than loading the tissue that we're actually trying to work.
And pulling on this thread a little bit about why bodybuilders are so profoundly fucked up. I'm just kidding. No, but pulling on this thread a little bit about treating bodybuilders specifically, I wrote down a question earlier that I've heard some people mention or reference. I'd be curious to see if you would agree, disagree, or if you noticed this. Talking about how folks who are consistently exposed to like high loads, not only acutely but chronically and cumulatively, over time, how sometimes it seems like they need more, even in a clinical context, to nudge the body towards adaptation in comparison to perhaps like your average mom or dad whose bodies aren't being stressed as much, that perhaps that they might need less to adapt. Have you noticed any of those trends? So specifically that bodybuilders might need a greater dose of perhaps a manual technique or load in a certain position to nudge the body towards adapting in a favorable manner, in contrast to average day folks, or not at all?
In the treatment context
Yeah.
specifically?
Yeah. Or anything that would lead to favorable modulation of pain, perhaps.
Yeah. Yes and no. So if you have more tissue, yes, in a sense, it's going to take more force for me to necessarily like to create a change, right? Working on like I've worked on quite a few bodybuilders at the gym, and if they just have that much tissue, it can be a little bit tougher to kind of get into these spaces. But at the same time, you can kind of look at these like one is like a vehicle that is, maybe a little more luxury, a little more tuned up. Whether or not they've beaten themselves up, it's still generally something that's functioning a little bit better. That includes the joints. Whereas if you have somebody, yes, maybe mom and dad, but if they are, for example, overweight, if they are running high inflammation through their body, right, we're going to start seeing joint degeneration a lot quicker. Even though the tissue is looser and there's less to get through, it's not necessarily a healthier tissue. One of the guys that I learned from when I was in school, his like best friend and client or patient was Lou Ferrigno. And that was like our question to him. We're like, is it hard to work on Lou Ferrigno? Like, he's massive. And this was back years ago when like Lou was still like, or at least just out of competing kind of thing. And he said, no, he's like, it's like working on a Ferrari because it is kind of a fine-tuned machine. Now, not everyone who works out at our gyms are fine-tuned machines.
Not necessarily Ferraris.
But yeah,
there's a few Civics in there for sure.
Some Hummers,
a couple of Volvos. Yeah, I don't know. But yeah, I mean, so I think it can kind of balance either way. Yes, there's more tissue to work through. It might take more. There's going to be more scar tissue likely built up in some of those tissues. So if we're looking at like dry needling context, it's probably a little bit harder to get through that much density of tissue and create a change than it would be on Susie, who I can probably just quickly get in that needle. But again, there's more work to create that adaptive change. The response rate is probably what's faster. Maybe not the actual work, but it's that response rate, because they're the person who's already trained and maybe a little bit more proprioceptive and has a feel for their body will quickly kind of adapt to the rehab and the tissue changes that you're creating, because they'll kind of have a sense of things. Whereas it might take a whole whack of rehab to, once you free up the shoulder, get everything back to kind of where it needs to be in terms of pattern and stability on, Joe Schmo type of thing.
I am also curious, we've talked about manual therapy sort of in the periphery a few times. When are you determining that like manual therapy is going to be an important aspect of the rehabilitative process? And then potentially, you mentioned dry needling, which is something I've had done before as well.
Yeah.
When might you apply, say, something like dry needling or an adjustment or like a particular other method?
Yeah. And I think that's the fun part with me is like I am a rehab focused chiro, but I still use a lot of manual therapy techniques. And I'm not necessarily privy to one more than another. I still do adjustments. Do a lot of soft tissue, lots of ART, deep tissue work, dry needling, shockwave, tools, whatever I kind of feel like is going to create the biggest modulation or change in that individual. And everyone's going to respond a little bit different. Some of it is trial and error. But again, it all comes down to the assessment. If I'm seeing a ton of restriction in an area, the rehab likely could create that change, but I can probably blast through that a lot quicker, create that change faster, and then we get a higher turnover with their rehab. So to answer your question, it's going to be like based on the assessment. First is always kind of a movement pattern or an exercise to see what am I seeing? Is it an ankle restriction? Is it somewhere? And then is it the tissue that is creating that restriction? Is it just like neuromuscular where the nervous system is guarding? If that's the case, is loosening the tissue the best thing? Maybe not, because the nervous system is guarding that for some reason, right? Sometimes it's then you give stability to that area and the body's going to respond faster, because a lot of times tissue tension is put there for a factor of safety by the body, right? So a great example is baseball throwers a lot of times will get trigger points in their pec. And that is because, again, they're having to get into these extreme positions. So if they get to a point where the body feels unstable, the joint itself feels unstable, it's going to riddle the pec with trigger points to shorten that movement so you don't get back as far. So it's protecting you from going to a range that it deems unsafe. So again, this is going to be kind of a deep dive, but then it's the question is, if you get rid of those trigger points, great, you've opened up that range, but then are you now putting that person in a position that's potentially unsafe, in the sense that if you don't give them something to restabilize or work on, then you're kind of, are you almost loosening it too much? Because obviously the body put that there for a reason. So on the other side of this, I don't know if you guys have ever heard of like DNS, dynamic neuromuscular stabilization. You're getting a little closer to it over there. It comes from the Czech Republic. I've done a lot of my training through that. And their kind of school of thought is like trigger points are put there by the brain. Again, it's trying to protect you. So if you give the brain that sense of safety, you give it more stability, it will melt away those trigger points. So if that's the case, maybe I don't want to use dry needling. Maybe I don't want to use soft tissue, because it just needs more stability, and that's going to give it, again, what it needs. So it all comes down to that assessment, really.
And then, so that if we continue with this example, right, of a pitcher who has trigger points in their pec, and based off of the assessment, it's pointing towards that there might also, like, the reason why this might be there is because there's a lack of stability at the GH. Mm-hmm. How might you create stability at the GH joint? So for instance, like for the trainers that are listening and they're like, that's me, or maybe that's one of my clients, what might be some of the things that you would do or consider?
I was going to make a joke, but I'll just skip on that.
Do the joke. 100% do the joke. Yes.
Buy my course.
There you go. Do you have a course?
I don't, but maybe soon. We'll see.
Hey, man. Yeah.
So again, it's like, this could be a million different things that you would do, and it's going to be individual specific. But to me, it's always creating as much joint centration as possible. So again, if we're talking the shoulder context, like, you want that GH to be centrated. A lot of times with trigger points, with instability, we tend to get out of that like centrated position. That's where we classically see impingements or bursitis or things like that, because we're not in that centrated position. So I'm going to use exercises that are going to create as much joint centration as possible. So loading that shoulder in a position where I'm actually loading it in a centrated position, which might sound super simple or might sound super complex. Meaning, like, a banded external rotation to me is not going to put that shoulder in a centrated position. is it working the rotator cuff into external rotation and you're strengthening some of the rotator cuff? Sure. I'm not saying that exercise doesn't have a time and place. I don't really love it, but time and place. But to me, it's not going to centrate that shoulder. It's not going to help them with that. So I want to load the shoulder in a position, and that might be something where you're more sideline. Maybe it is something where it's banded, where you're having to overhead resist a bit of a banded force that's forcing you to then, retract and keep that shoulder in a better position. So it's hard to throw out one exercise because it is going to be individual specific. A lot of stuff sideline too, where you're actually, so you have them almost on their side and you're having them rotate in and out. So you're getting that GH to rotate internally and externally over a position where you're kind of basically pushing into the floor. And so you're using everything in that external rotated position to drive forward and then close back down. Kind of, again, like a hip airplane, but for the shoulder and in a more like compact centrated position. And then maybe we get more sport specific. It all depends on how much time do you have? What do you need to establish with this individual? Are we off season? Are we in season? If we're in season, I might try and be more sport specific right away, get them into that far position, get a band or a kettlebell or something where they can drive and stabilize in that position. Now that we've then like opened up the trigger points, let's say, the likelihood is like if they're having trouble, that overhead position isn't going to get rid of the trigger points right away, unless that is what they need and it creates that like compact stability that their body's searching for. And so sometimes it's trial and error until you figure out, okay, what's actually creating a change, rather than like, oh, I'm going to give you this, take home and let's see. It's like, let's test it. Let's see, does it create a change? Usually it will create some sort of change in the moment pretty rapidly if it's the right thing for that individual. Not fix everything in 1 second, but you'll see change.
Do you use like position specific? So let's say someone is really sensitive in a certain position, or a certain position is very provocative for their symptoms. Do you use that as a means of informing? Okay, let's say like you have symptoms in this specific position. Use overhead as an example with when you're making reference to like in a sports specific context, but even in a non-athletic context, like let's say it's mom and dad down the street, and when they're putting their mug in in the cabinet or what have you, that's when they get like sharp kind of acute symptoms. Would you, during your intake, like make note of like, oh, there's something specific about that position, and so we're going to do work in that position? Like, would that be something that you would do, or or would you do something else?
No, 100%. I mean, the minute you tell me what it is you can't do, I'm going to go watch you do that. Mm-hmm. Right? I love the like, oh, your shoulder hurts. Okay, let me not make you do that at all. Like, I need to see it, and I don't really care I do care, but I don't care if it hurts you, because I need to know what's going on. Even if that means like, ouch, like all I can do is that. Cool. Let's see what we can do. Sure. Let's see what it looks like passively versus actively. Do we unload the tissues and it gets better? Cool. I already got an indication of what's going on there. So you could put them in that position. And so like a lot of the school of thought that I like using is like, I want to put you in about 3 or 4 different positions that gave me the same point of information back. So different movement patterns, but ultimately it all comes back to, yes, it's this, or X is not working, or this tissue is what's irritated, rather than just even just like, yeah, I lift and go to the cupboard. That's not enough information for me. What is causing that you can't go into that position? So if I can try different, movements and try internal rotation, let's say, for example, we're talking about that again, but like, or external rotation, like
it's the problem that unites all mankind, every human being. Just internal rotation is garbage.
Let's go back to the dinosaur question again. But yeah, like, so again, like I can test your external rotation in a position like this, right? But I can also test external rotation when you're laying on the floor, or when you're doing like a wall angel type of thing. Like you can test those things in multiple different positions to, again, give me the same information. And then if I'm seeing, oh, it's actually more the spine that's not really allowing them to move, they can externally rotate when they're like laying and they're more stable. Then you can kind of, okay, that's maybe what you need to chase, because where the pain is also not usually where it's coming from.
Right.
But that's another tangent. So
maybe for later.
Yeah.
I did have one question. We had discussed this a little bit yesterday on the podcast that we did with our roundtable, and issues sometimes with medical professionals and how they communicate movement and exercise being a part of the rehabilitation process, which is essentially don't do stuff. Do you find that you get pushback, maybe in particular from Gen Pop, where they have a certain notion of what they should and shouldn't do? And then how are you communicating? Like, actually, no, you should be integrating all this exercise in, and that's going to accelerate your rehabilitative process.
Show them 100%. So I use a bunch of different like skill sets to put into one, but if you guys know what McKenzie is,
Yeah.
basically, again, end range movements to create change. You're going to find a direction of preference, one that helps, one that doesn't. So I take them through that. For example, low back pain, right? Bend forward, I can't touch my toes, it hurts, it's pulling, it's pain. Okay, let's try different things. We try different positions. We might find that extension actually gives them relief. That's the key of McKenzie. Great, let's do more extension. Let's see what happens. What I like about McKenzie is I've now shown that individual that they can move and actually get rid of their pain, which is a direct buy-in for them.
Cool.
The amount of times I've had people after a visit or two not come back, and this might sound bad for my own business, but because you show them that they can move without pain, and they're like, I'm good, like I'm okay, like I'm just, and if you find the right direction, you can a lot of times, like, I don't want to say cure, I hate that word, but you can help or fix, or whatever word we want to use, pretty quickly. Again, you can't bend forward, you can't touch your toes. We make you do a bunch of extension. You go back to touch your toes. It's okay. But you've also then given yourself that, like, you're not fearing that you shouldn't move a certain way or that you shouldn't do something. You're now teaching that person that they can find a position or a movement that's going to help alleviate this, rather than just like, I need somebody else to solve this. And they might at first, but like the goal is to empower that client or that person.
Yeah, you just took the word out of my mouth, man.
I was watching your reaction, ET. I was like, I feel like he's going to talk about this soon.
Yeah, I mean, and there isn't much else to say other than I'm really happy to hear that, and I think that it's unfortunate in not only from what I've observed, I'm not a clinician, but having just worked with a lot of clinicians so far over my career, and then also with just various professionals, individuals who will knowingly and sometimes unknowingly do things to cling to business, even though it's not necessarily what is the right thing for the person per se. It's kind of, it's driven by the pocketbook.
Well, you need to come in 3 times a week for the next 2 years. So.
Right.
Which is like, it's still a thing. It baffles me that it's still a thing in chiropractic. And I've had a lot of people come to me from those situations, and I'm still just a little bit mind blown. But that's because that's not the right thing for the person. That's just what's kind of like best for that individual or for that practitioner. Nothing against anyone who does that. Well, okay, maybe there's a little something, but
I'd be disappointed if there wasn't.
Yeah. And again, it's all going to be based on that individual. I have clients who come in and they're in so much pain that maybe McKenzie, maybe movement, whatever it is, does not help. And so it may take a little bit longer, and it may be just pure treatment. There are contexts where that is the case. You can absolutely not bend over. You're just absolutely inflamed, or maybe it's a raging disc, whatever it might be. Most of the time, I'm still going to test and try and find something that's going to help you. And maybe it's just a positional change. Like, okay, let's get you laying in this X position for a certain amount of time, in and out of that. So again, it's still kind of movement based. So I always want to regress something like where you're at, then let's go 10 steps down if we have to find whatever that little baseline is. But I may just have to gravitate more towards something like acupuncture or something like that, where I can reduce the intensity of the system, take down the nervous system, and then we can kind of revisit some movement from there. I don't think treatment, over movement is always bad. It's just context dependent.
No doubt, man. I think I don't know if you would agree with this, but I think we're aligned on this, which is like, the outcome perhaps matters less than how you got there, right? Like if you're selling someone 2 years, 3 times a week, you come in 10 minutes, snap, crackle, pop, done. And the intent and how you got to that decision is, I want to be able to pay for my BMW kind of thing. In contrast to what do Bob and Karen need? Or perhaps even what do they want? Like I've had people from a training context, not from a clinical context, who are like I'm always trying to teach them. I want them to like better understand so that there's a little bit more independence and they're not as dependent on me. But I've had people tell me just directly, they're like, not interested in that, not interested in learning. I want to show up. I want you to spoon feed me this shit. Um,
Yeah.
and that's cool. And they know what they're potentially leaving on the table, but it's like an informed choice, and at which point I do think that that's fine. And that's why I think that like how you get there really, really matters. Would you agree, or would you add anything to that?
No, I would agree. And I do. Yeah. I mean, I think there are some people who just don't want to do the work either. They want to come in, they want to get the treatment, they want to feel better. My argument would be that's probably not the person for me. If you're not
Sure.
willing to
Yeah.
do these things, maybe we're not a fit. And I'm the further I like when you start in your career, you're like, I want to help everyone and I don't want to let go of any potential client. Right. But once you get far enough in your career, you realize that you're like, I'm not a fit for everyone.
No doubt.
That could be personality wise, or that could even just be my style, my treatment, or the fact that you don't want to do the things that I know are going to benefit you. Now, that's not to say like, okay, kick you out right away, and I always try and, educate somebody on the benefits of that. Like, here, listen, like you may not want to do these things, but these are the things that are in the long run. And I always tell that to people. I'm like, you can get the best treatment in the world, but if you don't change any of your habits, if you don't do any of these things, you're going to be right back in here very shortly. So it's just about educating that person that these things are going to benefit you in the long run. So you don't have to keep coming back here. And if you want to, then, I mean, that's your personal decision. But yeah, so I think, like you said, it's intent of what you're trying to achieve.
Love it.
When we're talking about communication, I'm going to kind of take a bit of a sidestep here. I think, having listened to you for the last hour or so, much like a lot of the guests that we've had on here who, are educators or, I think of Dean, who's like a PhD, et cetera, people that have this really deep understanding of their like field of study. There's a lot of nuance, and you've used the word context about 100 times, but I think that's really important, right? Like I think a lot of these conversations are so individualized to that person at that time, and yet on social media, it's incredibly difficult to communicate that nuance. So I'm curious because you're pretty active with throwing content and stuff out on social media. How do you find that balance of having informative information that, you can't really be as nuanced as you'd like to be, but still have it be somewhat accurate and helpful?
As somebody who has built a business through social media, what I'm going to say is probably not the best thing, but social media now kind of sucks because it's just gone so far in one direction. It's become so much entertainment, or like it is really just entertainment, or what's going to get the best view. And I think it's easy even for myself to get caught up in that. It's like, what's going to kind of be catchy? And you kind of almost have to be now. If you're not catchy in the first little bit, people are off. They're on to the next thing. They don't have enough attention span. So it's hard to convey really good information in that kind of container. And that's what becomes challenging, is how do I provide? So you almost have to go into this realm of, one of my mentors kind of taught me this aspect of it, is like edutainment, where you are finding a way to deliver information in an informative way, but it is also kind of fun. But everything has to be taken with a grain of salt on there, because you have 30 seconds to 1 minute to explain everything. And you can no longer just turn on your camera and just talk straight to the camera. It doesn't really hit anymore. It's kind of a sad reality, is we're all actors now in a sense, right? So it's, especially those who like you see are doing very well on socials. Some of it's luck, but a lot of times it's because they've created it. They found that way to be somewhat like entertaining and educational. So I just think, everything has to be taken with a grain of salt also. Even the stuff I say sometimes on there, I'm like, I had 30 seconds to tell you this information and you want to capture some attention. I'm not saying you should say things you don't believe in, because there's a lot of that as well, where it's like, well, I'm going to say this controversial comment because it is going to just steer eyes towards me. I think you should absolutely like believe what you're saying. But yeah, I just think it's so tough now to like say. That's why stories are good, because the stories, you can tell a story, you can talk, you can take as long as you want, and people will kind of watch that. Whereas, yeah, just like reels and things like that, it's like, what are you going to say in 60 seconds that is really going to get your point across? And again, like we talked about this at the start with the red X and the green X. Is that good or bad? It's not necessarily one or the other. You take a piece of information from that, but people will just shred you to bits. Oh, well, this and this and this. And it's like, well, yeah, but like there's good information in there as well. And you just have to extrapolate some of that, as long as you're not like lying through your teeth to like get that across, I think is.
Yeah. Yeah. I love those points that you brought up. And I think there's something that you do really well that I've seen in your content, and also that you've like actively modeled in this conversation today, which is the use of ambiguous language when making direct statements. Like you'll use the word can, may, could, in contrast to will, or like inferring that things have direct connections. You are actively using pieces of ambiguous language to remind people of that, which I think is really important. It tends to be less inflammatory, but it's more honest. And I think that, like you said, I mean, I'm definitely one of those people that I just refuse to compromise on that. I will not compromise on that ever. It just goes against my values. And, and I agree with what you're talking about, where like the edutainment piece, I think that's such a great word, of like, yes, it needs to be educational. And if no one gives a shit about you because, you're a snooze fest, you're putting them asleep, how many people are you helping? Right. So there is a balance there that's hard to strike. Have you found that harder? And I think you mentioned this earlier, but you found that harder nowadays than perhaps initially?
100%. I mean, you even look back a couple of years, like everyone's a content creator now. Everyone's got a phone. Everyone's doing stuff. There's so much information. We're also slowly becoming, I don't want to say stupider, but we're just like, we're
is it Idiocracy?
Not, like
it tracks.
Like you got 3 seconds to get, like, that's really what the information is telling us now too. Like if you look at the stats, it's like attention span is about 3 seconds. If you're not entertaining in the first 3 seconds, the person is on to the next. So like swipe, I'm going to the next thing. So like we used to just, Instagram used to be like, if you were making a video, you just sat and you talked in front of the camera and people would get lots of views on those things. Now it's like you really can't do that. So I do think it is frustrating in that sense, because yes, the more people, this is the tough part of the game, is like you do want to reach more eyes, because that helps more people. Not only does it bring more people to you, but you're helping more people. This is like the age of free media, where you can put out a piece and how many people will see it, which to me, like 1,000 views is low, but I'm like, a room of 1,000 people is also a lot of people. So you got to, I'm not going to use the word context again, because I was told I'm not allowed to, to use that, but it is context dependent.
So the word nuance comes up in this podcast like every episode. So.
Yeah, we joke that like, we're going to have to like start having a drinking game where it's like anytime that either like myself or Ryan or Brett, who you haven't met yet, use that word, take a swig. I have a question for you with regards to business building, if you don't mind. And, sure. We think about, how would I say, building a business by leveraging social media is definitely something that's hot right now. And it's one of the first places where people go, especially if you want to reach fitness professionals. A lot of fitness professionals have their attention on Instagram. That's why we have a presence there, in the interest of full transparency. That being said, there are other ways to build a business that have also stood the test of time. One of them is referrals. Mm-hmm. And given that you yourself are a clinician, I'm curious what your answer to this would be, which is that what are some things that you as a clinician look for in a fitness professional that you're like, yes, like this is someone that I would trust my patients with, if you can't necessarily work with them and maybe they're in, I don't know, Orleans or something like that. It's a little far for you, but you met this trainer who's based out of there and you trust them, like what would be some of the things that would perhaps lead to trust being created between yourself and that trainer that might be increase the likelihood of you, trusting them with your patients?
Yeah, that's a fair question. I think, and I have quite a few relationships with like local trainers as well that I've always referred to. When I was at 613, I had great relationships with the trainers there. Again, because like that's an amazing working relationship when you can treat somebody and then have a conversation with their trainer and do that. So even from that standpoint, like there's so much value there. But it's also like on my side, I'm like, I don't want to send anyone to anyone. I want to know that I'm sending to somebody like who's going to be valuable. So, I mean, I think they've got to share the same values as you. I think it's not necessarily the education, but it's certainly their understanding of maybe mechanics is like, you don't have to know every little detail, but I think just understanding movement or why you're applying something like that at a surface level conversation might be hard to know exactly. But I think you can kind of extrapolate if you are a potential client talking to somebody, you can kind of extrapolate through the conversation, like one, what their values are, potentially what their intentions are. Like, are they trying to sell you right away? It's not to say like a good salesman is still going to try and sell you at the end of the day, but it's their approach on it, right? And they're going to listen to you a lot more. I think if the person is talking about themselves, which here I am talking about myself, but if the person
here, man, it's good.
there's others here. But I think like if the person is constantly just like talking about themselves or what they can do for you, I'm not saying that's bad. But that could be a sign that like they're kind of projecting something that's more there than it is. Whereas if they're really inquisitive and they want to know more about you and like how they can help you and all these things, I think that's a great indication that like, okay, they're listening. They might provide some feedback from what you told them, but they want to know like, okay, are we even a fit? That should be the first question is, are we a fit? I ask that to people who come to me all the time through social is, let me ask some questions to see if this is even a fit. Like, hey, can you work with me or can you coach me? Like, cool, but I don't know if I can. I don't know if I can help you. I'm willing to turn you away if you are like, I've had a few that are like, triathletes and things like that. Can I help you get stronger? Can I help you change your physique, work through injury? Yes, but am I a triathlete myself and have the greatest understanding of that training context? No. So am I your best fit? Probably not for that specifically. So I'm willing to say that it might not be something I can help you with. And I think that's something most like trainers are probably not willing to say is like, I don't know this and no. And there's nothing wrong with figuring it out a little bit as you go. I think we've all done that at one point in our career.
Yeah.
Mm-hmm.
You're not going to learn otherwise. It's a bit of trial by fire, but also willing to say, I just don't know, or I don't know, and I'm going to find out or educate myself.
So one of the things you look for, I guess, within trainers that you might work with would be like intellectual humility, or intellectually honest, humility, curiosity.
Yeah, curiosity for sure. I think that's a big one. I mean, obviously just intelligence. You can, if somebody's, I mean, there's great trainers and there's not so great ones. And the same applies for physios, chiros,
For sure.
osteos, doctors. So it's, yeah, I mean, I get that question with chiro all the time too. Like, how do you know if somebody's like a good chiro, right? And I think it does come down to like the questions, the value, what are the intentions, all of those things. You can usually, I mean, for me, I'm like, if the person's just in the chiro context, if they're just going to do like a crack and you're out the door, that's an immediate no for me. Like there needs to be a little bit more than that. Some people like that and that's fine. I'm not going to dog on that, but that's to me is like, if you want the best, results, that's not it.
Mm-hmm. Yeah. Cool. Ryan?
Do we want to rapid fire unless you've got something else?
I have, I do have one follow-up question. If you don't mind.
Go for it. Go for it.
Follow-up question, but I've been kind of like chewing on it for a little bit before we get to rapid fire, which is that, and maybe this is a two-part question. It's definitely a two-part question now that I'm thinking about it. So, you mentioned that chiropractic care has a little bit of a history, right? If we think about kind of like where things were before, it was very much the norm, like 10-minute appointments. You come in, crack, done, like a conveyor belt of clients, right?
Still exists. Yeah.
Yeah, it still exists. But it seems like more and more chiros specifically are like really leaning into this understanding of perhaps some of the gaps in how, in how things were practiced before.
Mm-hmm.
Seems like a lot more chiros are leveraging exercise as a therapeutic intervention as well, kind of coupled with what they're doing clinically and therapeutically. And so because of that, my two-part question is, number one, I'm really curious what led to you getting into chiropractic. I always find that origin story fascinating. So I would love to know like what led to you kind of choosing to go in that direction. And then the second, it's very unrelated, but what are some misconceptions about chiropractic care that you think people need to understand?
Yeah, both great questions. I mean, I don't have a magic chiro story. Some people went to the chiropractor and something magical happened. I did have one instance where I like completely blew out my back landscaping, went to a chiro and was like fine the next day. So I think everyone's kind of got one of those, which isn't always the case. I would be much better at my job if I could just adjust everyone once and everyone would be magically better.
Mm-hmm.
But for me, it was I got injured in high school, blew out both my shoulders. They're both separated. Both my AC joints are separated. So I went through physio for a very long time. And there was a point I couldn't even roll myself over in bed because I couldn't push off on my shoulders. The only thing I could probably sit and do at that age was like play video games comfortably. Everything else, like I remember like I was going to the gym intensely and then I one day couldn't even like do a lateral raise with like 5 pounds. So that led me to get my own treatment. And at that time I was in high school, so I was going through anatomy courses as well. So I started to really enjoy understanding the human body. And then the help that I got, like getting out of pain and being able to get back to the things I wanted to do, that was something I wanted to do for other people. So I actually got physio before I got chiro, and I was going into physio. There was no question about it. Went to the University of Ottawa, did kinesiology or human kinetics, it's called here.
Mm-hmm.
Was 100% going into physio. And I remember my dad even said, like, as I was applying for schools, he's like, well, why don't you just apply for chiro as well? And I was like, they just crack bones. Like, I'm not doing that. Like, and I remember distinctively saying, I'm not doing it. And then there was a summer I worked for a chiropractor back home. I wanted to get more into the space. So there was a chiro back home. And so I hounded her for a job and she let me work for her. And it just opened my eyes to all the things that she was able to do. She did everything. There was no limitation. She gave people exercises and stretches, taught me how to do it and show them. We did a lot of soft tissue on individuals. Yes, there were adjustments, but it wasn't just that. You know, there was everything, including acupuncture and all of that. So I just got to see like the limitless possibilities of chiropractic. And that's why I went down that route. And it truly is whatever you want to make it. I think if you have a sports background, if you have a training background, you're going to make it more of that. If you don't have that at all, I have a lot of classmates who pretty much probably don't do any of this type of like rehab and they just do the chiropractic kind of side of things. And that's fine. But I think the more modern chiros are starting to blend more of that now. They're seeing the value in it. We also know the literature supports that like basically like manipulation or manual therapy of some sort paired with like exercise or other therapies or modalities will create the best result. And that can include an adjustment, but it is not solely like the adjustment. I think to come to your second question, like the common misconceptions, I think there's still, it's kind of crazy that there's still so much like kind of a bad rap to chiro that we're only adjusting people. I think you hear a lot still about like that we're going to hurt people or, and sure, it happens, but that could literally happen in any profession. You know, so I do think there's still just that like bad rap of like that chiros only adjust and that's all they do, or I don't want you to crack my neck. I get that all the time. Yeah. And most of the time I'm like, we're working on your ankle. I'm not going to crack your neck. And it's sad that I have to tell you that because that's what you think is going to happen here. So, and there's clients I don't even adjust. Some ask not to be adjusted and some I just don't because that's not what I feel they need. If I feel that the adjustment is the best tool for the job, whether you want it or not, I'm going to explain to you and tell you that this is probably going to give you the best result. Obviously, if they say no, I'm not going to do it. I'm just going to force them. It's so funny, man.
When you started saying like whether you want to or not, I was like, uh-oh.
Yeah, sorry.
I'm
not
snapping.
not
I'm
against
snapping your shit
will.
up. I don't care if you want it or not.
Just lay down.
Lay down.
Yeah, not against your will, but I will explain to you that this is what I think is best for you. Is more what I meant. Yeah, that sounded a little.
The lead-in was dicey, but you landed it. You stuck the landing.
I got out of the moguls. We're good. But yeah, I mean that's pretty much. I think the biggest misconception is still just like the adjustment, and then that's all that we do, or that we need. Even like the X-ray side of things, like, oh, do I need X-rays for this and this? The amount of people I tell, like, no, we don't need like you don't need X-rays to know what's going on. I think people still kind of have that in the back of their head, that this is X-ray is going to, or even like, it's almost like there's a power of healing apparently in the image, because people seem to think if they get an image that's immediately going to solve their pain. I'm like, you're still going to have this at the end of the day. And the likelihood is that we can still assess and figure it out without the imaging, unless I see red flags or things that tell me, okay, this is not resolving. This is not acting the way that it should. Let's go see what's missing. But the X-ray is not going to tell me how to better adjust you or how to work on you, or so there's still, I guess those are some of the common things.
If you don't mind, I just want to just kind of piggyback on what you were saying. I'm really happy that you addressed the misconception that essentially like chiros hurt people. I think it's really unfortunate, because I've had the pleasure of working with like more fantastic chiros than I have, perhaps ones with questionable methods. Perhaps we'll put it that way. I was looking for a simpler way to put it, but I've worked with far more really competent chiros who, when you really start peeling back the layers and talking to them about the nuances of what they do, why they do it, and the various tools they use and how they use those tools, they take a very intentional kind of nuanced, take a drink, context specific approach to what they do. But unfortunately, yeah, that's it. Drink away, man. And it's really unfortunate when people generally make the mistake of reducing down an industry to some of the bad apples.
Right.
And I'm so happy you brought that up, because especially with the swing that I've noticed that you touched on as well, of like how chiropractic care, you mentioned even like modern chiropractic, how would I say, like the modern chiropractor really has, I think generally speaking, is very different than the chiros 15, 20 years ago.
Yeah.
Maybe even only 10 years ago. And, but unfortunately, I think like people's experiences with some of like how things perhaps has left a really bad taste in people's mouths. Anyways, I'm happy that you brought that up, because at least in my experience, like we shouldn't throw the baby out with the bathwater, so to speak, when it comes to chiropractic care. Like, definitely has a place within, like, I guess all of like the holistic offerings for folks. So really happy that you touched on that.
Yeah. And I think like I get the question all the time too, is like, what's the difference between chiro and physio or any of those professions? And I'll say, honestly, if it's like nowadays, if they are good at their job, there really shouldn't be that big of a difference. We should be doing fairly similar things, maybe using different tools, but ideally still trying to get to the same end goal. Like chiros are probably still going to adjust a little bit more than any other profession. So that is something we use in our tool bag a little bit more, but we're doing acupuncture, we're doing soft tissue, we're doing exercise. Not all chiros again do that. I think we become a little more unique when we are using all those skill sets. But yeah, it shouldn't be that different. Like I can do all the physio stuff in a sense. I'm sure a physio will come at me and say completely differently. But outside of maybe like things I don't really want to work on, like post-op rehab, if you're right out of surgery, I probably don't want to work on you, because I'd rather work with you when you can really start to load and move. So I'm fair enough to say, yeah, go see somebody who is going to do that. But anyway, I'm getting off track.
No, that's okay. Ryan, take us away, man.
All right. So something that we do with every guest on here, the first time that we have them on, is we do a series of rapid fire questions. So just first thing that pops on the top of your head, roll with it.
Cool. Oh, God. Okay.
They're not bad. Trust me. So our first question is, what is your favorite book, movie, and concert?
Okay. And they don't all have to be the same thing. Favorite book. I really enjoyed Think and Grow Rich. I don't know why. I just really resonated with that book. I'm diving more into the world of self-development and business and all of that kind of stuff. So really like that. Movie. Oh man, there's so many. Um, Comedy would probably be like Step Brothers. I think that's like a goated movie. Or I'm really into Lord of the Rings right now, so I'd probably go that route.
Solid.
And
Solid
then
answer.
you said music. Was that the other one?
Concert.
Concert. Nerdy enough, I just saw Lord of the Rings in concert, and that
Oh
was
yeah, I think I saw
fantastic.
that. Yeah.
But concert, I don't know if you guys know them, but I really like Mountjoy. I think they've been some of the best concerts I've ever seen. They're a little
Sweet.
more low key, but yeah.
Cool.
Favorite and least favorite food.
I mean, favorite in the less healthy context is going to be pizza. I think you can't beat pizza. Least favorite, oysters or anything that is slimy and gooey in texture. I can't do it. It's not for me.
Yeah.
Proudest moment outside of business.
Oh, that's I don't know. I guess this could be considered proud. I mean, I got engaged this past year. We're heading towards getting married. So it's kind of a proud self moment, I suppose.
Go, man. Congratulations.
Sure.
Thank you.
Favorite athlete growing up. You can't say Michael Jordan.
For sure, it's Michael Jordan.
I mean, I still to this day, my favorite player ever is LeBron James. I'm a LeBron over MJ guy. And then Sidney Crosby for hockey, 100%.
Cool.
What 3 values guide you?
I don't know if this is value specifically, but I think hard work, perseverance, and trying to be, I guess, empathetic or understanding of others' situations,
Sure.
which can be hard these days, or driving in a car, that can be hard. But
favorite and least favorite lift.
ooh, okay. Bulgarian split squat, probably my least favorite. I don't think anybody really enjoys them. Okay, some do.
I don't mind them. I don't
Ryan's
mind
got a
split
big old
squats.
dumpy. He loves it.
I like it. I like it single arm supported,
Okay.
where you can just like really concentrate on that. But the act of like balancing and doing everything else,
Yeah, I would say supported. I like better.
yeah, I love that because you can really drive into it. Okay, and then favorite would be some sort of rowing movement. I'm definitely more of a pull strength guy than a push strength guy. So some sort of like, I love a good like plate loaded seated row, like a nice low row. 613 specifically, that one at the very far end by the leg press.
Yeah.
I don't know why, I just love that. It just feels good.
One misconception about you.
That's a great question. I don't know. I feel like I used to get this. I don't know if I get this a lot. I was kind of shy as a kid, so I think people thought I was kind of like an asshole just because I was kind of straight faced and maybe a little bit shy. So I think I'm not like that now, especially with the chiropractic profession where you talk to new people every single day and you gotta, be nice and smile. But I think in the past I was, because of my shyness, it came off as like snobbish or like, but that wasn't me at all. I think most people wouldn't think that.
City or country that you would love to visit?
That I would love to visit. Country would probably be Thailand. I think that's where we're thinking of doing our honeymoon. So I'll say Thailand, and it's far, so it'd be nice. And then what was the other? Was there a pairing to that?
Or city?
City. Prague, 100%. Prague city.
Dope.
I don't know why, man. You look like a Thailand guy. When you said Thailand, I'm like, yeah, I see it. I don't know why. I could see you just like ripping up Thailand for sure.
I like to rotate between like going to Europe one year and then going somewhere like I did Brazil the other year, or like Hawaii a couple years back. So I like bouncing between something that's like, I don't know. Yeah.
Cool.
And then our final question is, what is one hard truth that trainers or coaches who are trying to build their business need to hear?
Work harder. Like if you're not, I mean, that's true though. Like if you're not willing to, if you want to build a business, it's not coming to you. Like you got to be willing to put in the hours, put in the time, whether that's online, in person. Like people are afraid to like spend the day treating or training or whatever. Like work harder. Nobody cares. Work harder.
Love that. I would agree. I definitely agree with that. I know Ryan agrees with that.
Yeah.
It's been really fun getting to know you, man. And I think that people, on the heels of today's interview are probably going to want to be kept abreast when it comes to your course that you're developing, right?
It's in the works. It's in the works now. It has to be now.
That's it. Now it's in the works. He's starting today, folks. You heard it here first. So if people want to follow, your journey for, course creation, or if people want to learn more about you, follow your journey, where can they do that?
Yeah. So whether it's just following me on social, wanting to know about my coaching or chiropractic, you can find me at Dr. Yannick Schulz on Instagram. Same applies for TikTok or any of my other sources, formerly known as Modus Chiro, but that recently changed a couple months back. So now it's just Dr. Yannick Schulz.
Cool. Amazing. Well, listen, man, thank you so much for prioritizing this and coming on today. It's been a lot of fun getting to know you and picking your brain. And I look forward to meeting you in person. I'll be in Ottawa within the next few months. I look forward to when our paths will cross. And like I said, just thanks again, man. It's been a lot of fun.
It's been a pleasure. Thanks for having me on, guys. This was a lot of fun.